Hello aspirants, welcome to GDC English Classes YouTube channel and welcome to Pharma 360 degree MCQ series. So in this session, we will discuss MCQs on antipsychotics under central nervous system. So antipsychotics are drugs. They help in the treatment of psychosis, also known as schizophrenia. This psychosis is characterized by abnormal behavior, abnormal thoughts in the person, excess aggressiveness. And regarding psychosis, there is a positive symptoms of psychosis, negative symptoms of psychosis. The positive symptoms of psychosis like hallucination, delusion, abnormal thoughts, behavior, excess aggressiveness. Negative symptoms of psychosis like a decrease in social interaction with person, decrease in cognitive skills, and especially lack of happiness, lack of self confidence. So like that way. So let's start our first MCQ. So which of the following is an antipsychotic drug? So simply what they are asking, which of the following is a antipsychotic drug? Which of the following is an antipsychotic drug? So flupentixol, rasaziline, clobazam, divalproic acid. So divalproic acid nothing but it is a mixture of two valproic acid compound. It is an antiepileptic drug. Clobazam, a benzodiazepine, comes under sedative hypnotic. And rasaziline, a anti-Parkinsonian drug, selective inhibitor of MAO-B, monoamino oxidase B enzyme. And flupentixol is a antipsychotic drug. So the answer is simply option A. So here the antipsychotic is the flupentixol. Flupentixol is an antipsychotic. So next question. The second question is venlafaxine. So venlafaxine is a FDA approved drug for the treatment of major depression, generalized anxiety disorder, panic disorder, as well as all of this. So the answer is very simple, all of this. So venlafaxine generally it is an antidepressant drug, helps in the treatment of depression. The depression is mainly because of decreasing neurotransmitters like noradrenaline, dopamine, serotonin in the brain. So it helps in the treatment of major depression, generalized anxiety disorder like worriness, and panic disorder. So if you suddenly see any accident, if you suddenly see snakes, you will become panic. So for all this purpose, the venlafaxine is a drug approved by the FDA for the treatment of all these conditions. Next question. So drug which does not have any antiemetic as well as extrapyramidal action. So drug which does not having antiemetic function as well as extrapyramidal side. Generally, first generation antipsychotics, they may have anti-emetic action. They help in preventing one thing, and they may also having side effect extrapyramidal symptoms like Parkinson's. But among this, you can commonly observe trifluperidol, triflupromazine, risperidone. These are antiemetic and they may produce little bit extrapyramidal symptoms like Parkinson's as a drawback. But clozapine is a second generation antipsychotic, does not having antiemetic as well as extrapyramidal side effects. No antiemetic action as well as no extrapyramidal symptoms. Next. So all are side effects of clozapine except the exception will goes to granulocytopenia, seizures, sedation, extrapyramidal symptoms. Okay, so generally all are side effects of clozapine except. So answer will goes to generally seizures. So sorry, extrapyramidal symptoms because clozapine is a second generation antipsychotics. Second generation antipsychotics does not produce extrapyramidal symptoms. Extrapyramidal symptoms example Parkinson's. So the answer is simply extrapyramidal symptoms is not a drawback of a clozapine, but clozapine may produce granulocytopenia, seizures, sedation as a side effects. Next question. So regarding the next MCQ, which of the following extrapyramidal effects seen with antipsychotic agent, also known as rabbit syndrome? So these are all are generally seen in case of extrapyramidal symptoms. So extrapyramidal symptoms are common drawback of antipsychotic, especially first generation antipsychotics. because they block dopamine in the nigrostriatal dopamine pathway. The nigrostriatal dopamine pathway. There is one of the dopamine pathway in the central nervous system, that is nigrostriatal dopamine pathway. This nigrostriatal dopamine pathway regulates the body movements by balancing dopamine. But our most of the first generation antipsychotics, they block dopamine in this area and decrease the body movement and develops one of the body movement neurodegenerative disorder, Parkinsonism as a side effect. So Parkinsonism is an extrapyramidal symptom. So which of the following extrapyramidal effect seen with antipsychotic agent? It is also known as rabbit syndrome. Okay. So acute dystonia, Parkinsonism syndrome, tardive dyskinesia, perioral tremors, uncontrolled contraction. So peri around oral cavity, perioral tremor. So this perioral tremor is resembling like a rabbit syndrome. For example, why it is known as rabbit syndrome? When rabbit is eating something, so it is movement like this. So rabbit mouth movement. So that like rabbit mouth movements are observed in case of patient with perioral tremors. This perioral tremor is one of the extrapyramidal symptom. So its movement resembling like a rabbit chewing movement while eating. Rabbit chewing movement while eating. The answer is very simple. Perioral tremor. That is rabbit syndrome, and that is the answer option D. Next. What is the next question? Drug of choice for the treatment of negative symptoms of schizophrenia. So I already told you there is a positive symptoms. The positive symptoms of schizophrenia are psychosis because of excess levels of dopamine. The negative symptoms of psychosis are known as because of there is reduction in the dopamine function. So drug of choice for the treatment of negative symptoms of schizophrenia. First generation antipsychotics like chlorpromazine, trifluridine, haloperidol. The first generation antipsychotics majorly for treatment of positive symptoms of schizophrenia or psychosis. But when coming to second generation antipsychotics like clozapine, olanzapine, risperidone, quetiapine, all second generation antipsychotics can help in the treatment of first positive symptoms as well as negative symptoms. So, drug of choice for treatment of negative symptoms of schizophrenia. Chlorpromazine, first generation drug. Haloperidol, first generation drugs. Doxepin, a antidepressant. Clozapine is a commonly used second generation antipsychotics. It helps in the treatment of negative symptoms of schizophrenia. First generation antipsychotics can only treat positive symptoms of schizophrenia. Second generation antipsychotics can treat both negative and positive symptoms of schizophrenia. So, clozapine is a second generation. It helps in the treatment of negative symptoms of schizophrenia or psychosis. But psychosis. Okay, next. Refractory schizophrenia. What is the treatment of choice? Refractory schizophrenia means resistant. It is normally psychosis is not responding to all drugs. So resistance, decreasing response towards the drug. So especially refractory schizophrenia means the schizophrenia is not responding to all drugs. The drugs getting resisted. The condition is not treating. It is not responding to the drug. That is refractory schizophrenia. Then what is the drug of choice for treatment of refractory schizophrenia? So haloperidol first generation, flupentixol first generation, trifluperazine first generation, clozapine can be drug of choice for resistant schizophrenia. In case of which, if other drugs are not responds well, then clozapine is a drug of choice. Clozapine is a good drug. It is a second generation antipsychotic. It can helps in treatment of both positive and negative symptoms of schizophrenia and psychosis. Answer is clozapine. And so regarding first generation antipsychotics, they only helps in the treatment of positive symptoms of psychosis or schizophrenia because they only block dopamine receptors. When coming to second generation, they helps in both treatment of positive as well as negative symptoms of schizophrenia because they block both dopamine and serotonin receptors in the central nervous system. Next question. So let's have a discussion on next question. Which of the following atypical antipsychotics would be the least sedative? Will be the least sedative. So all are means atypical. Atypical antipsychotics are the second generation antipsychotics. Atypical antipsychotics are second generation antipsychotics. So quetiapine, risperidone, olanzapine, clozapine, all are second generation antipsychotics. So among this, which one having least sedative? Which one having least sedative? That is risperidone. Answer will be the risperidone. So risperidone is also a one of the antipsychotic. Among this, it is having the least sedative property. Generally, antipsychotics may produce a sedation because of they block histamine. Blocking of histamine in the CNS may produce sedation. What is the next question? Drug of choice for akathisia. So akathisia is also one of the symptom observed in case of psychotic or patient with schizophrenia. Abnormal muscle movements. Okay. So the drug of choice for akathisia, central anticholinergic, propranolol, levodopa as well as dantrolene. So propranolol generally a beta blocker. This propranolol also for treatment of this akathisia. Okay. So this akathisia especially regulates unwanted muscle movement. Sorry. This propranolol control the akathisia. Akathisia means abnormal muscle movements like tremors, like shivering. So here propranolol block beta 2 receptors on the skeletal muscle and regulates this abnormal muscle movements in the feet as well as hands. Feet as well as the hands. Because beta 1 receptors located on the heart, blocking of beta 1 receptor helps in the treatment of hypertension. Blocking of beta 2 receptors in the muscles regulates the tremors, palpitations. Next. The next question is the most common side effect associated with the chronic use of phenothiazines. One of the phenothiazines is chlorpromazine. So phenothiazine, chemically chlorpromazine is a phenothiazine. Chlorpromazine is a first generation antipsychotic. So most common side effect associated with the phenothiazines. Phenothiazines are first generation antipsychotics. The first generation antipsychotics may produce akathisia, may produce Parkinsonism, may produce tachycardia, may produce muscular dystonia. So they commonly produce Parkinsonism. Parkinsonism is one of the movement disorder. And I hope you know that regarding the etiology of Parkinsonism, drug-induced Parkinsonism, antipsychotics may produce Parkinsonism because antipsychotics are the drugs. They decrease the dopamine function in the CNS for treatment of psychosis. During the treatment, if the dopamine decreased in the nigrostriatal dopamine pathway, if there is a dopamine decrease in the nigrostriatal pathway, there is a decrease in dopamine level. There is a decrease in the dopamine levels. Decreased dopamine levels in this pathway develops movement disorder, that is Parkinsonism. Develops movement disorder, that is Parkinsonism. So along with Parkinsonism, tardive dyskinesia also. So tardive dyskinesia means the tongue may be outside. For example, if you observe the dogs, some dogs put their tongue outside only. So decreasing movements in the tongue, decrease in movements in the lips, decrease in the movements of facial muscles, tardive dyskinesia, decrease in the movements of facial muscles, decrease in the movements of tongue. The tongue is protruding outside due to lack of its movement. So, most common side effect associated with the chronic use of phenothiazine, tardive dyskinesia due to decreasing dopamine in the central nervous system, especially nigrostriatal dopamine pathway. The drug effective in the treatment of tardive dyskinesia. The drug effective in the treatment of tardive dyskinesia, central anticholinergics, dantrolene, succinylcholine, valbenazine. So central anticholinergics, they help in the treatment of Parkinsonism because Parkinsonism is a decreasing dopamine, increasing acetylcholine. That excess acetylcholine should be come down by centrally acting anticholinergic. And dantrolene is drug of choice for malignant hyperthermia, a severe increase in temperature of body. Malignant hyperthermia. Malignant hyperthermia is one of the major drawback of succinylcholine. Continuous usage of succinylcholine may increase the release of excess calcium. That excess calcium by act on skeletal muscle increase body temperature. So dantrolene helps in the treatment of malignant hyperthermia. Malignant hyperthermia is one of the common drawback of succinylcholine. So among this, 𝘿𝙤𝙏, one of the new category of drug from the FDA, approved for treatment of tardive dyskinesia. Approved for the treatment of tardive dyskinesia. Answer is 𝘿𝙤𝙏 is a drug of choice for treatment of tardive dyskinesia. Answer is 𝘿𝙤𝙏. Next. Which of the following drug is used in treatment of intractable hiccups? Hiccups. I hope you know the knowledge about hiccups. Chlorpromazine, amisulpride, venlafaxine, loxapine. Okay. So chlorpromazine is a prototype drug. First clinically successful antipsychotic is chlorpromazine. This chlorpromazine helps in the treatment of intractable hiccups. So if hiccups are there, we will take the water. Simple. But in some persons, the hiccups become disorder. They continuously comes. So for that purpose, they have to take the treatment. Chlorpromazine is one of the drug of choice for treatment of hiccups. Next. So here, all of the following drug causes QT interval prolongation. So prolongation of QT interval in the ECG produces 𝘖𝙎𝑑. So excess or continuous prolongation of QT interval in the ECG produces 𝘖𝑑, that is ventricular tachyarrhythmias. So continuous prolongation of QT interval, it may produce 𝘖𝑑 is known as ventricular tachyarrhythmias, abnormal rhythms in the heart due to excess ventricular muscle contraction. So here, which of the following drug does not cause QT prolongation, does not produce 𝘖𝑑? Zotapine, amisulpride, ziprasidone, quetiapine. So all of the following drug causes QT prolongation except zotapine. Zotapine having less chance to produce QT prolongation, excess ventricular muscle contractions of heart. Because especially the second generation drugs like ziprasidone, all DOMS like ziprasidone, risperidone. Okay, so these drugs are generally produces QT prolongation. These two 𝘖𝑑. The answer is zotapine having the less chance to produce QT prolongation. 𝘖𝑑, that is ventricular tachyarrhythmias. Okay, next. Flupentixol. Flupentixol is a type of antipsychotic. Phenothiazine, butorphanol, thioxanthin, atypical antipsychotic. Atypical antipsychotic is a second generation antipsychotic, and the all are first generation antipsychotic. And flupentixol belongs to the chemical class thioxanthin. Phenothiazine, chlorpromazine, butorphanol, 𝘖𝙤𝙎𝑑, droperidol, like that. Okay. So the answer will be simply, so thioxanthin is a chemical class flupentixol belongs to the chemical class thioxanthin. Okay, so thioxanthin is a chemical class and flupentixol comes under thioxanthin. Next MCQ. So anti-emetic effect of chlorpromazine is due to blockade of H1 receptor, B3 receptor, M2 receptor, beta-2 receptor. So apart from the beta-2 receptor, remaining muscarinic receptor, dopamine receptor, histamine receptor, all these receptor involvement in the production of vomiting, nothing but emesis. But here chlorpromazine antipsychotic Antipsychotics are having anti-emetic property also. The chlorpromazine antipsychotic property is because of blocking histamine receptors. Blocking the histamine receptor. Histamine receptor blockade having the anti-emetic action. So chlorpromazine is antipsychotic, okay. It is also produces anti-emetic effect because of blocking histamine receptors in the CNS. Next. What is the next question here? The abundant inhibitory neurotransmitter found in the central nervous system. Which of the following neurotransmitter highly present in the central nervous system? It is function as a inhibitory neurotransmitter. Gamma glutamyl transferase, gamma linolenic acid, gamma aminobutyric acid, none of these. So you know the answer simply gamma aminobutyric acid is one of the inhibitory neurotransmitter highly present in the central nervous system, both brain as well as spinal cord. So this answer is very clear. I hope you know without showing the answer also. So even glycine also one of the inhibitory neurotransmitter. It is highly abundant in the spinal cord, less in the brain. Okay, next. So what is the next question here? Smooth muscles, cardiac muscles and organs are regulated by central nervous system, parasympathetic nervous system, sympathetic nervous system, autonomic nervous system. So what they asked are smooth muscles, eye smooth muscle, lung smooth muscle, gastric smooth muscle, uterus smooth muscle, urinary bladder is also smooth muscle, cardiac muscle and organs. Mostly they regulated by the autonomic nervous system. Yes, central nervous system will regulate, but here they clearly mention these muscles and organs. So they are clearly regulated by the autonomic nervous system. Autonomous, regulate their own action. Heart, it regulates its own. No need of our signals. Please stop, please forward. Okay, autonomic nervous system. Stimulation of central nervous system causes all the following except. So stimulation of central nervous system. So when CNS stimulated, euphoria, excitation, state of well-being, insomnia, lack of sleep. During excess CNS stimulation, lack of sleep. Convulsion, excess stimulation of CNS increase the release of glutamate aspartate. Excess glutamate aspartate may produce convulsions, seizures, and disorientation. Disorientation, decreasing the function of CNS. Lack of the focus on the goals. Disorientation, orientation, proper way. Disorientation, no proper way. So disorientation is not a property of or feature of CNS stimulation. ABC are the commonly observed in case of CNS stimulation. Disorientation is a wrong answer. So the answer for this question is option B. ABC observed in case of CNS stimulation. Option D not observed in case of CNS stimulation. Next. So anxiety. Anxiety is caused due to which of the following neurotransmitter imbalance? Anxiety is a general worriness in the human beings. It is common. Maybe if you worry about money, worry about studying something. If that anxiety unable to control, this anxiety increases sympathetic function, increasing the heart function. It may lead to excess sweating, abnormal heart function, abnormal respiration. It may lead to death also if anxiety, worriness not controlled. The anxiety because of increasing GABA activity and decreasing serotonin, increase noradrenaline and dopamine, decrease GABA and excess serotonin, decrease noradrenaline and dopamine. So simply, especially in the treatment of anxiety, we have to reduce the serotonin function, we have to promote the GABA function. Because there is a reduction in the GABA levels and increasing serotonin levels in the anxiety. That's why our drugs should increase the GABA function and slightly reduce the serotonin function. So anxiety is because of imbalance, decreasing GABA and increasing serotonin in the brain, especially in the region of amygdala, as well as limbic system also. Answer is the option C. Decreasing GABA levels and increasing serotonin levels may produce anxiety. Next. cyclic KMP, cyclic KMP. So these are like a secondary messenger, like cyclic adenosine monophosphate, cyclic guanosine monophosphate. These are like secondary messenger. Generally, these secondary messengers mediate the action. For example, like this is a receptor. So when a receptor occupied by a ligand molecule like 𝘂𝙁, it will transmit a signal into the receptor. Because of that signal, there is a production of a secondary messenger, and these secondary messengers are responsible for the mediate the action, increasing cyclic KMP levels on heart contraction, decreasing cyclic KMP on the heart relaxation. So these are the secondary messages. They are known as neuromediators. Neuromodulators like adenosine. So the answer for neurotransmitter like serotonin, adrenaline, epinephrine, norepinephrine, etc. So answer is neuromediator. These are the secondary messenger. These are neuromediators. The answer for this is option C, neuromediators. Okay. So this is simply about today our discussion on MCQs related to the antipsychotics and little bit depression as well as anxiety also. So psychosis also known as schizophrenia, where there is a observation of excess angriness, abnormal behavior, thoughts. So this treatment of antipsychotics with help of first generation antipsychotics, second generation antipsychotics. First generation antipsychotics mainly block the dopamine receptor, helps in the treatment of positive symptoms of psychosis. Second generation antipsychotics block dopamine and serotonin receptor, helps in the treatment of positive and negative symptoms. First generation antipsychotics majorly produces side effect as extrapyramidal symptoms. Example, Parkinsonism, tardive dyskinesia. And also, first generation antipsychotics also produce hyperprolactinemia, excess prolactin levels in the body. Coming to second generation antipsychotics majorly produces adverse effects like 𝘿𝙄𝙎𝘆𝙁, excess ventricular contractions, abnormal rhythms of heart arrhythmia. And second generation antipsychotics also causes hyperlipidemia, hyperglycemia, and obesity also. Okay, this is regarding our session. So please focus on your preparation and all the best. Subscribe to GDC English classes.